Wind shift overnight brought much of that smoke, as you know, from the Panhandle down to Lubbock and our surrounding areas. And it was certainly visible across Lubbock. Even last night when we got off the news, you could smell it. And many people reported smelling it even inside their homes.
KCBD News Channel 11's Natalie Falkenberry joins us in the studio now with a look at our air quality and the health concerns that come with all this smoke from the Panhandle.
Well, Karen and Abner, Lubbock's air quality is looking much better today compared to what we saw last night. However, medical professionals say the smoke coming from those wildfires can be a health concern, especially to vulnerable groups.
Just stay indoors as much as you can, and then close the doors and windows.
Dr. Fiona Prabhu, a professor in the family medicine department at Texas Tech Health Sciences Center, says although you can't see smoke particles in the air with the naked eye, prolonged exposure can be unhealthy for the immune compromised.
If you have chronic obstructive pulmonary disease or asthma, that can definitely cause a flare-up of either of those conditions because of the smoke and particulate matter that you inhale.
Dr. Prabhu tells us small children, even those that don't have pre-existing conditions, are the most at risk.
Airways are smaller, their lungs are smaller. If they've already started getting reactive airways or asthma, then they're more likely to feel the effects of the smoke inhalation.
Prabhu recommends staying indoors and circulating or purifying existing air throughout your home, but not everyone has that luxury.
I would recommend actually wearing a mask, just like we did with the pandemic, just to try and make sure your nose and mouth is covered so that you're getting a little bit less of the smoke particles in your nose.
After all those tips, if your symptoms worsen, Dr. Prabhu says that's when you need to see a doctor.
If you're very short of breath, you can't catch your breath, you are very concerned that, or you're starting to develop like fever, chills, anything that's more like an infection. If you're feeling like you're wheezing, then I think that's more when you need to seek medical attention.
We have been monitoring Lubbock's air quality throughout the day and will continue to update you as conditions of those wind patterns shift. There will also be a link to this map on our website. Karen and Abner.
Thank you, Natalie.